Question for you. Are you always tired, irritable, gaining weight? Doesn't seem to be any reason. Could be your thyroid. It's a small gland located at the base of your neck, and if it's not working properly, it can lead to a host of health problems. Now, January is National Thyroid Awareness Month to highlight some of these problems. Joining us now here on the morning show, Dr. Zeeshan Aziz with St. Augustine Ear, Nose, and Throat. Good to have you here.
Thank you. Thank you very
So
much.
people often look at those symptoms, fatigue, being overweight, irritability, and they dismiss it as being related to something else. How does the thyroid play a role?
Well, the thyroid, just to take a step back, actually is a small gland, as you alluded to. It's located along the lower front part of the neck. It happens to be shaped like a butterfly, and the wings of the butterfly are analogous to the right and left lobes of the thyroid gland. This gland is part of the endocrine system, and the whole purpose of the gland is to secrete a hormone called thyroxine. It's also known as thyroid hormone. And this single hormone does so much for our bodies, especially in regards to our metabolism. It controls our basal metabolic rate, our core body temperature. It influences our heart rate, our blood pressure, even how fast our fingernails and hairs grow, the tendency to lose weight, have energy, fatigue, even our mood. All these things, at least in part, are due to this one single hormone. So it's really important to pay attention to whether your hormone levels are adequate or if they're too high or too low. And that's for that very one reason that January is Thyroid Awareness Month.
So the signs of hyperthyroidism can basically be gleaned by taking a blood test, looking at those hormone levels and things like that?
Absolutely. It should first start off with a detailed history and physical examination by your doctor, followed by basic blood work to assess the function of the thyroid gland.
When do you sit back and you go, okay, it's not just my lifestyle or life's issues that are creating a problem. I've got to see a doctor about this. Is there some moment that triggers that response?
Usually when the symptoms are real severe, if you have a lot of these symptoms that we talked about, anxiety, feeling jittery, palpitations, sweating, if these things are happening and they're happening at a much more severe level, it's about time to see your doctor.
How about best treatments?
Treatments typically involve anti-thyroid medications if your hormone levels are too high. If it's too low, then you actually have to be on a hormone supplement.
Mm-hmm. And other lifestyle changes that can help with the situation?
Not typically. This is typically due to an imbalance of the hormone itself, so that needs to be corrected.
Mm-hmm. And we have a list of other things in addition to the ones that we've already talked about: depression, constipation, hair loss, and menstrual problems. And these are all just real-life issues. You and I talked about the fact that you can't really self-check, but you can find a mirror, stretch the neck back, and look for a bump or something and go, this just doesn't seem right.
That's absolutely correct. Sometimes you can have a growth or a mass in the thyroid gland, and it can be found just as easily as that. In fact, that reminds me of a patient that his girlfriend, he's a 17-year-old boy, and his girlfriend noticed an area of swelling just because of the way he happened to turn his neck, and that was the way how they diagnosed the papillary thyroid cancer was pretty advanced. So sometimes it can be as simple as that, but I would not recommend self-checking because a lot of the times patients don't know, people don't know what's normal and what's not.
Dr. Aziz, thank you very much.
It's been a pleasure. Thank you very much. And I wanted to say happy birthday to my mom.
Hi, Mom. Happy birthday. And don't forget, you can keep up with the latest health headlines on newsforjax.com. Just click the Health tab on the homepage.